One of the many benefits of being a Mott's Wealth Management client is the opportunity to meet and speak with industry specialists and professionals. Our speaker for the long-term care seminar is Jodie Daniels, Assistant Executive Director and Director of Community Relations at Chestnut Knoll Personal Care, Memory Care, and At-Home Services. Ms. Daniels has dedicated her career to developing and implementing quality programs for older adults. This presentation was recorded on May 11th, 2016.
I'd like to thank everyone for coming. This is our long-term care seminar, and Jen Botzler really worked hard to put this together for us, so thank you so much, Jen. Really appreciate it. So our next event is our halftime report on July 27th. You'll be getting an email with an invitation for that as well. And as always, these events are perfect opportunities for you to introduce us to someone you know who might be interested in utilizing our services. Because, these are just a fun kind of event where there's no pressure or anything like that. We're not selling anything. So if you're interested, let us know. And if there's someone that can't make it and they're interested, we can do something different, more personal with them. And I want to make sure I thank our sponsor for the evening, Dave Fiorita from Delaware Investments. Thank you, Dave. Appreciate it. So, this is a topic tonight that I'm really glad you're all coming out, because it's typically one that people do not want to think about or talk about. It's kind of like, And I've been personally dealing with it myself this past year with my mom. And so for many of us, when we're actually, have a parent or loved one that we're working with, it gives us a real good idea of what's going on or what could happen. So I find that that's typically the best way to get an introduction to what can go on out there. So first I'd like to introduce Jodie Daniels. She's from Chestnut Knoll Personal Care, Memory Care, and At-Home Services, which services the Tri-County area. We've been using their service for my mom as part of the home care. My mom's in Limerick, and she's had the need for various levels. It started with an hour a week, and it went up to just about 24 hours a day. And now it's back down to 2 hours a day. So with different, falls and things like that have happened. So we are really grateful to have them available. So Jodie has committed her career to working with developing and implementing quality programs for older adults. She has a degree in health planning and administration from the Penn State University. Her passion for caring for elders led her to a certification in long-term care administration from Temple University. Jodie also earned the certified senior living credential and prides herself on staying abreast of the latest trends and innovations in the field of retirement services and living. In her leisure time, she enjoys spending time with her 4 children, reading, and doing anything outdoors. So thank you so much for coming, Jodie. You take the stage.
4 children. I'm happy to be that. Well, thank you for having me here tonight. My name is Jodie Daniels, as I was introduced, and I am a licensed nursing home administrator and a licensed personal care home administrator. And caring for older adults has been the passion and continues to be the passion of my life. I was adopted at age 8 from the foster care system by people who were in their 50s, and so while I was 8. And so I tended to be around older adults, and I think that's kind of what drove my passion for care and services. And I had the privilege of caring for them for about 10 years between the 2 of them, my mother and father, before they passed away. And so certainly that front-hand experience of trying to do it yourself, first of all, and trying to have a life of your own, maybe, and trying to get your mother to think that it's okay for you to boss her around, really brings a lot of challenges to and a lot of insight professionally that I couldn't have had otherwise. My mother experienced dementia, so I've experienced that live, and the behaviors and things that go with it. And that's where I learned that it's important to educate yourself, because and I love to read and I love to brainiac everything to death and think it through logically, but even when you have that, you cannot intellectualize your way past your emotions about the whole thing. So be sure to have a friend that you're talking to as well that knows what's happening, because I could care for any one of your parents, yourselves, my children, anyone. I love being a caregiver. It was really difficult when it was my own parents, because I was grieving the loss of them right in front of my eyes. So always have support and help and educate yourself to what's around. My work experience, I worked for Presbyterian Homes out of Camp Hill, not Philadelphia Presbytery, and I was a nursing home administrator. I administered some of their continuing care retirement communities, one in Oxford, Pennsylvania, Ware Presbyterian Village, another one in Devon, and one in Westchester. After that, I went into the planned giving and major gifts part. They were a nonprofit organization, and I was the regional director of mission support for them. I found my way to Boyertown when I found that I couldn't care for my mother myself anymore. And I decided it was time to look for care. And I experienced the same guilt emotions that some people feel. Even though it's great care, better care than you can provide, when you get resistance to making that sort of change, it's very heart-wrenching. And so you try probably too long to keep people at a level of care that's probably not completely safe. And I did that. And so I found Chestnut Knoll by looking for care for her. And unfortunately, she didn't make it there because she passed away from something else prior to admission there. And then my father, who was a World War II veteran, prisoner of war, missing in action, Purple Heart, who could farm and bale hay until he was 90 years old and run me to the ground, might I note. Bailed and did everything till he was 90, developed some sort of cancer, and I ended up using hospice services for him at Chestnut Knoll. So that's how it was close to where they lived, and I needed to come back around the homestead because my most important responsibility is to care for my family. I can go back to the other professional things. I wanted to just talk about the handout I gave you. There's space in the back of the handout for note-taking. I wanted to just talk about this handout because it was a conscious choice that I made to choose this handout because it was created by the United States Administration on Aging and the American Bar Association. With the age of the internet, there is so much information out there that you really need to look at who you're turning to for support. For veterans benefits, for elder law, many of these words are marketing semantics at this point to draw people to certain individuals for business. So it's important to look at the credentialing agencies of each of these organizations so that you can get the benefits that you're entitled to if you're a veteran, and you can have access to the proper terminology so you can really research what you're deciding upon. The baby boomers are the big rush in the United States, although I heard the millennials are catching up. I must say I can't keep track of all of them except to know that I think we have 4 different sets, styles, X, Ys, millennials, boomers in the workplace all at once. And I must say I can see some of the characteristics as I look around at them. But the baby boomers born from 1946 to 1964 and the greatest generation before them are creating a land swell in the care and services. And it's exciting because the market is demanding more creativity. So that's really very exciting. Consumers are going to want things that are different, and products are popping up, giving people more opportunities for different styles of care. The largest growth in population at this point is what they call the oldest of the old. And I apologize if it's offensive to anyone, it's a term that was coined. But it's those that are 85 and above. And that's a group that's growing the fastest out of the baby boomers because people are living longer, which makes asset management very critical. I mean, oftentimes I hear people who say, I didn't expect to live this long. I thought, my mom died when she was 60. Well, with cardiac interventions and technology that has surgery that can be done laparoscopically, there's a lot more curative, and people can live longer, healthier lives. And that's exciting too. 60's the new 50 or 40's the new, it's all good. And if that's marketing, I'm buying it. So I just wanted to talk about the different levels of care as well. Oftentimes, when you begin, I essentially divide levels of care into 3 areas: independent living, personal care, and skilled nursing, if you really want to simplify things. So independent living in this marketplace and beyond looks very different in many ways. There are 55 plus communities that are completely lifestyle choices that have amenities and beautiful homes, and it's a lifestyle change at that point with no health care unless you bring it in from another agency yourself. There are independent living communities that have more services, housekeeping, laundry, that sort of thing, and they're month-to-month leases. And then there are the traditional continuing care communities, where you buy in under some type of contractual agreement, and then you have all the levels of care on one campus and the assurance of care. They are regulated by the Insurance Commission. Those levels of care define where you can receive independent living. When people, and also in your home. So you can also remain living independently in your home. At that point, you can bring people in. Non-medical home care, like you referenced, our Chestnut, Knoll at home. Non-medical home care is now appearing as franchises. So in some cases, I call them the McDonald's of home care, because anyone can get involved with them, whether they have a background in healthcare or not. And that's not a bad thing, as long as the person knows how to utilize the appropriate healthcare providers within their model, within their business model. So non-medical home care meets your needs at your home, where you need it. My suggestion in that model is that you make sure that their employees are their employees and not subcontracted employees. Does the organization hire their own and cover them through their comp and through all their insurances? Or are they subcontracted and the agency is just brokering them? They can provide you with care 24 hours a day. Typically it's supervision, activities of daily living, bathing, dressing, things that you wouldn't need a licensed nurse day in and day out to do for you. We also have benefits for that. There is a veterans benefit to help pay for that level of that in-home care. One of those benefits is not financially qualified, so it's not asset-based. So there is a 2-hour-a-day benefit that varies from 5 to 7 days a week based on the budget at the time for the VA and what they can afford to spend on the people that are using that benefit at that time. So there are many ways to pay. There are also county programs for in-home care. When care goes beyond I think the time that you make the decision about whether in-home care is sufficient or you should begin looking seriously at a move to a facility is, number one, what is more cost effective? Number two, what is the benefit of the person living in that home? Now, there's a huge sentimental benefit, that people have with their homes, certainly. This is where I raised my children. This is where my husband lived last with me. This is where we've lived all these years, whatever they are. And when you go out and assess people, as I do, what you find is they are socially isolated. Their quality of life could use improvement outside of those four walls. But those walls are so symbolic that they don't want to move out of fear, probably, and out of sentiment. So going in and assessing for safety in the home, and also encouraging them individuals to come out of their home. Because taking care of people certainly means taking care of their physical needs, but taking care of people means taking care of their psychosocial needs as well. Helping them not to be lonely. I always say if I have a happy heart and a hurting knee, my knee doesn't hurt so much. But if I am sad or depressed or lonely, all I'm going to think about is my knee. And so when you think about quality of life and, these years in your life, who wouldn't want to be as active as you can be? And thankfully, again, the stereotypes of hitting your rocking chair when you go into retirement are gone. There's data to show that exercise makes a difference. We have an optimal living program that's a target program. It's beta tested by Temple University, where we have a full-time exercise physiologist that keeps up formalized exercise programs through a resident's entire residency there. Now, mind you, the average age of our residents are 85 years old in our secured memory care, and 87 years old in our residential care. They have shown that progress can be made statistically in strength, mobility, and balance in that population and beyond. We have a woman who's going to be 101 in September. We got her out of a wheelchair. She's walking again. So when you see things happen, kind of keep in your mind, the appropriate level of physical care with the people who are trained to work with older adults, who are not meaning to be like sports trainers on the sidelines hoping to see fast progress. They're not the guys for the job or girls for the job. But with time and energy, consistency and effort, people's bodies can rebuild. There's a saying that says our minds lose our memories, but our muscles do not lose their memory. So even individuals who have dementia-related illness, Alzheimer's, vascular dementia, Lewy body, whatever it is, have the opportunity with the right environment, time, and person to continue to be mobile, which is very important to quality of life. So there are a lot of exciting programs out there. You'll have my information if you want to hear about any of the studies. There are capstone projects being done. It's really exciting, and I'm looking forward saying, wow, as I head into the retirement years, it's going to really be great to see that there's a different way of looking at quality of life. And if somebody has a stroke, you don't just give up on them at that point. They can get better for 18 months. 18 months of work can help somebody regain function. So it's a very hopeful scene. Assisted living and personal care. This is merely logistics at this point. You may have seen some organizations advertising that they are now licensed as assisted living. Personal care is a level of care that is licensed by the Department of Human Services in the state of Pennsylvania. We are inspected, and a couple of years ago, the state had promised that they would provide medical assistance to the personal care level of care. Personal care tends to run from $3,500 or $3,800 a month on up, depending on where you are demographically and what services you're getting and the like. Well, with the promise of regulations, of reimbursement, came the regulations. And so at that point, there was a division between assisted living and personal care. So everything had been personal care in the past. So everyone was calling themselves assisted living in the past. Everybody who was licensed as personal care was calling themselves assisted living because it's a cuter term than personal care. It's more attractive, more appealing to consumers. Now they are separate. They are regulated separately. They can provide similar things. The money never came from the government, so there is no subsidy, government subsidy for this level of care. However, there is a generous benefit through the Veterans Administration for widows of veterans and veterans or couples called the improved pension. It used to be called the aid and attendance pension. So some people receive $1,100 a month up to about $1,800 a month tax-free from the VA to help offset the cost of care.
What was the amount again?
Between $1,100 and $1,800.
Thank you.
And even if you're living in the community and you have a loved one, you can work with your financial planner to help to access this benefit in this level of care. So it's important to know through the VA. If you call the VA, you might hear that they know nothing about it. I've learned that when I first came back to working in personal care from working in CCRCs, I first heard about this benefit, and so I got the VA book out of the library. Do you want to know how thick the VA book is? My Lord, it's like this. Because I would keep calling, I'd hear things, I'd see things at senior health fairs, and no one could tell me exactly what was what. So I returned the book pretty much immediately and decided to go another route to find things out. I met with the VA and found that this benefit's actually been in place since after World War II. It's been modified a couple of times, but I can tell you for a fact that right now many people are able to afford personal care instead of needing to going to nursing home care because of that additional income per month. So assisted living and personal care. And then there's skilled nursing. Licensed nursing homes regulated by the Department of Health, a licensed nursing home administrator, typically a medical model of care still. They look more like hospitals, sure.
What do you get in personal care or assisted living versus skilled nursing?
It depends on the facility. There's enough variability in providers, and there's enough flexibility within the law and the regulations that if you have good outcomes, you can care for any level of frailty. For example, at Chestnut Knoll, we all came to this single site facility from major corporations. So I have a nursing background as well as my degree in health administration and experience in the field. I believe in a model of care that provides clinical services in a residential setting. So I know how to case manage, and we know to bring services in, and we allow it. There's some personal cares who don't want any wheelchairs. Well, there's no regulation that says you can't have anybody in wheelchairs, but that's the image they want for their community. There's some that say, if you get to a certain point with your dementia-related illness, then you need to be transferred to a skilled nursing facility. Each facility has its own philosophy, and it's an excellent question to ask, and the plain old question is, what would cause you to tell me my loved one has to move? Financial's the clearest. I mean, if I'm out of money, I'm out of money, and I have to move, because there is no subsidy like Medicaid for personal care or assisted living. But what is it, what behaviors? We see a lot of people transfer to us because a facility can't handle the behaviors of somebody with memory impairment. So what is it that you find, or maybe a better way to get an answer would be, out of your discharges this year, what have the causes for discharge been? To make it more clear. Because the last thing you want to do is find the right place, and we've experienced this, and I've helped people through this, and then a couple months later somebody say, I'm sorry, we can't care for them. You're going to have to find another place. Because that's traumatic for everybody. So the skilled nursing level of care is regulated second only to nuclear power in the state of Pennsylvania. Honest to goodness. And that's why I'm working in personal care now, to just take a break from all those regulations. But it is typically more of a medical model. In all cases, the survey results are posted online. So when you're beginning to look at places or think about it, go online and see how they have done in their actual surveys. See what their problems were. Annual surveys are done. They are unannounced, so you don't get the date in the mail, for the big, when you're going to show your best. You get the text that the state's here. And, I always tell everyone, don't get excited. If we're not doing it every day of the year, we're not going to be able to pull it off now. So you have to have your best foot forward always. And you'll see on those if there are medication errors, if there are food safety issues, skin breakdown, all those sorts of things. And it's a measurement tool. Also, beyond the chandeliers, as I call it, go in and look around. Unannounced, without an appointment. I always say, go look, listen, and sniff. I know. So when I walk around with people, sometimes they're like, you don't smell. I'm like, thank you. But yeah, look, listen, and sniff. They could have the highest degreed physicians on earth doing the best medical care, and if that day-to-day care isn't presenting itself that way, who cares? Like, what do you value more? Do the staff know the residents' names? They become part of our family, and they should be treated with the utmost respect. So see how the staff interact. See if the residents are enjoying each other. Just get a feel, for as non-clinical as that is, of how the building is. But start looking before you need it. That would be my number one piece of advice. And if you're a veteran and thinking, well, I can use the VA or something like that, go talk to them before you need it. Get yourself on waiting lists before you need it. If you know exactly where you want to be, find out their waiting list policy so that you know that they know you, they have your basic information. If crisis hits, you can say, you know what, I'm all lined up to go here. Or if you're a couple and you know you're caring for somebody that you're caring for at home, or your spouse is getting more ill, go look now, try and engage the person going, and get yourself known to that building and in a relationship so that you have a partner in crisis when it happens, and it lessens the crisis of a case manager calling you from the hospital saying, we're discharging tonight, and we can't find a bed in this county. Where do you want to go? I mean, those are unfortunate realities. And I'm sure you know, advocate, 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 advocate. And so, for example, in my father's case where he was baling hay in Berks County until he was 90 years old, I saw him as my strong dad because I was his girl. They saw him as a 90-year-old frail man who got a diaper whipped onto him the minute he got in the ER, and as a frail old man. It's disgusting, the ageism in this country in some ways. So be sure to articulate, you know what, last week he was baling hay. This could just be dehydration. This isn't how he looks every day. And if you say that once, say it 1,000,000 times on behalf of your loved one, so that every nurse, every therapist, everybody doesn't make an assumption about a person based on an age and a condition in that moment. That's unfair. Online reviews, look at online reviews. But, who puts reviews on? I don't know, people who are really happy or people who are really upset usually is the way I see it. So take those with a grain of salt. Make your own judgment. Listen to your friends and family and really look how many times has the ownership changed of the organization? What has their history of rate increases been? In personal care, the really important factor is to ask how they bill because a lot of them do what they call levels. So some organizations have kiosks by the residents' doors and the staff have swipe cards, and when they go in to care for that resident, they swipe. And a bookkeeper says, well, geez, you're only supposed to have an hour per patient day in a 24-hour period, and they were in there 15, 20, more. And there's money attached to that sometimes. So ask those questions about leveling, because that's how you'll know you're doing a correct comparison. When do you begin thinking about it? Now. What do you look for? Credentialed organizations. For resources in the community to help people age in place, the Alzheimer's Association, organizations that are known to you. You're certainly, any of you, welcome to reach out to me, or if you know somebody in the field that you trust to just ask basic information to, do it. Start talking. I'm sure everybody knows without it being said, and I hesitated to even say it because I thought it was obvious, but I'm sure everyone has a power of attorney. If you don't, please do, because that's what you really need. As an aside, I was called into a case in Delaware County where a man came across this is my closing story, a man came across his cousin. It was a big Italian family, lots of cousins of all generations of cousins. So they were involved with the Mitchell and Ness business, and et cetera. So he comes across the elderly cousin he'd been looking for, and oh, look where I found him. He is in a dementia unit in an upscale continuing care retirement community in Delaware County. Okay. I go visit, and the guy's always been eccentric, and so it didn't quite fit the mold for living in a community, and I think that's part of why he was in a dementia unit, because he wasn't really demented. He was just himself. And I found that out even more at his funeral when other physicians and things that worked with him at the Philadelphia College of Osteopathic Medicine came and told stories. I'm like, he wasn't demented, he was just that way. So anyway, we visited him. He said, somebody's taking my power of attorney, who was one of these cousins, lovely, beautiful woman in her 50s, coiffed. She's taking my money. She won't let me see my money. Oh, pshaw, pshaw. And my friend took it seriously, called me and said, can you help me figure this out? Well, 3 years later, with the involvement of Jack Whalen, the district attorney in Delaware County, and every organization under the sun, and everything I learned from reading Nancy Drew books, we found out that indeed she had taken $3 million from him. But listen to this. But the organization, the upscale, protected, we, as a person who holds a license, it is my legal responsibility. If somebody says, anyone, I don't care if they're in a dementia unit, I don't care if they're in the men's club, I don't care. If they say somebody is not treating me right, somebody's taking my money, it's my business to report it to the state. Whether I like the lovely woman, and I think the guy that I helped out is one of the most rude, egotistical people I've ever met in my life, might be, or I don't, I have to give that objectivity. It wasn't given in this case. 3 times it was taken to the administration of the facility which should have initiated a call to the Department of Health and the Ombudsman, and nobody did it. She almost got away. So just be careful. Have a good financial advisor. Have people who know you personally, know what you're doing. Have a power of attorney. Personally, I think there needs to be laws developed, and I'm working with some of the counties on this, to create a reporting mechanism for power of attorneys on a regularly scheduled basis. That they would actually have to report, not on demand, which is what it is now, but on a scheduled basis, they would have to report how they spent the money of the person that they're spending their money on, so to speak.
Can I ask you a question about power of attorney? Does it vary in different states? Because I'm understanding through a mutual friend that she has the power of attorney for her parents, who are both in a dementia unit, but the bank won't let them get to the money, and they can't pay the bills for their parents in the dementia unit.
So banks seem to have a whole different language about power of attorney than lawyers or anyone else in the world for that matter. And each banking system seems to have their own way about it. You probably can speak to this as much as more than I can. But having a power of attorney for health care, and even that's drawn up by an elder care attorney, there's a registry of elder care attorneys. Many call themselves that, but they're not certified and on this registry. There's still a lot of nuances in banks. So I would go to an elder care, get an attorney's help to access that money. Do you have any comment to that?
Yeah, I would say, thank you. I would say,
It's important to get the paperwork signed before someone is, so if I know I'm my mother's power of attorney and I'm seeing, things happening, I don't have to wait until she's in an institution or something like that to implement it. So, and when I say implement it, I mean go to the bank and say, okay, I have this power of attorney, and what do I need to do to be able to, sign checks for my mom, pay her bills, things like that for whoever, you're doing this for. And they will have another form. Okay? They won't take the power of attorney. They'll have another form. They may want to talk to the person, if they can come in, So it makes sense to do it ahead of time. I don't know what to do. Sam, you might. Sam Swanson's here. He's an elder attorney. He might have an idea what you do when the situation is the bank won't release any of the information.
Power of attorney, you'll wind up talking to general counsel for the bank, who will say, yes, your power is good, but you got to understand we don't have lawyers and rocket scientists out in all of the branches. They're instructed if the power isn't on our pink form, it's no good. So if you know mom is going to be banking with one institution, besides getting a broad power of attorney, get that institution's card, get it signed, get it recognized, and I think your way will be smooth and open.
And reminding your mom or whomever, allowing someone to have power of attorney. I mean, really, I don't have a power of attorney right now. Everyone should have them at any age, because who knows what's going to happen to us at any time. But getting the power of attorney, to my parents, were very private about money, old Pennsylvania Dutch people. They didn't have a lot, but they sure weren't going to talk about it. And I had to reassure that doesn't mean it's a power I'm taking away from them. Because clearly saying, you're in control of your own things unless you can't be, and that's the only time I step in. Wouldn't you agree? You get that sign while they're healthy. If you know you're going to be the person that's going to be in that position, do it before you're figuring out how to get them from the facility to sign something to, and will somebody judge that they're not competent, then you're in a world of mess.
You said you make home visits. Can you give me some of your experience with convincing people that it is time to go into skilled nursing?
I think don't let it be a family member. Really let it be somebody other than a family member to talk about it with them. Try and take your family to events at places and see places, particularly if it's past that time, I get that, but particularly with assisted living. People who are going into nursing now, assisted living and personal care hasn't been around that long. So when people think about long-term care, they think about the worst nightmare nursing home they've ever dreamed in their life or seen on 20/20, and you're about to put them there. Right, so take them to see what the reality is, if you can. take them out for lunch and stop by if they're having a concert on the lawn. Look at their website, and everyone does marketing events to bring people in. So go when it's very neutral and very non-threatening and not personal at all. And use as many people in their circle that you can. I mean, bring in their priest or their pastor, or if you have partners in caring for them who they have trusted, their physician. The generation now still listens to their physician. They're not Googling their results on the internet against them and arguing it, So use whoever they trust. Think about who they trust and talk to that person. And if that person's in alignment and in agreement, that at least helps to get that conversation started in a way that's reasonable. And I find when I go out, I can talk to people about these things, and I'm not their daughter, and it's matter of fact, and it's non-threatening, and, nobody's life dream is to go to a nursing home. I mean, it's like, woohoo! Oh, Susie, I woke up today, it's time to take mom to the home, No. So, any other questions?
Yeah, that's a good point, because I know with my mom and getting, having outside care come in, they did an evaluation. The nurse came in. They're so kind. I mean, they are just, really, really kind and sweet. And things where I would ask my mom, and she'd put up a wall, they ask, and my mom's talking to them about it, It's like totally different. So they know what they're doing, and they really care, and they really connect, and everybody really feels that. So, so I think that could be a good resource to just call and say, okay, can you have someone come out and evaluate? And that's one of the nice things if you do have long-term care insurance. Part of that typically is to have a care coordinator. So they do come out, they do evaluate, they do look at, what can be done and make recommendations and so forth. So that's helpful as well. All right. Yeah, I think the hardest part is the deciding. Once you find some place good or someone you can trust, and then it's like, such a relief. At least it was for me. So, and things have changed. At least I'm pretty sure now, in getting the care from my mom and looking at my own future. That's the thing I always have in the back of my mind. I care about my mom, but to be honest, I'm still thinking like, oh my gosh, I need to take care of this, or I need to make sure I, take better care of whatever physically so that, this won't happen. But, there had been in the past, many times you could have a caregiver come and stay, someone live in the home and so forth. But my understanding is there have been some changes there big changes that have been legislated as far as what they need to make and how many hours they can work, and they have to be relieved and so forth. So having someone staying over all night and the person getting up several times during the night, and then that person's responsible all day, there are laws and regulations now in place that do not allow that. You have to have them, they have to be, relieved, and they can only work so many hours and so forth. So that can add to the cost, definitely. And there are certain minimums that they have to make now, too. So things have changed just in the, in the recent past, yeah. All righty. Thanks so much, Jodie. I appreciate it.
I hope you enjoyed listening to Jodie Daniels, and if you have a friend or relative who is considering their financial options, please feel free to invite them to accompany you to one of our upcoming events. Visit our website at www.motzwealthmanagement.com for the most up-to-date listing of these events.